No way!
Awake brain surgery involves opening up the skull, removing the tumour, but everything is done while the patient is completely awake and the patient feels no pain. Conventional brain surgery is done when the patient is under GA, under full anaesthesia, and this patient is asleep, not awake, he's not aware of what's happening. Now, awake brain surgery is done in a condition where the patient is fully awake. And these surgeries are done in situations where we want the patient to be awake. That occurs in a situation where surgeons are dealing with very critical brain areas. For example, if you are doing surgeries for Parkinson's, we need to pass a very specialized electrode into very deep structures of the brain, and we'll be passing through other critical areas. We need the patient to be awake so that we know what is the effects. We know whether our catheter is placed in the correct position, and then we assess the effect almost immediately during surgery. We get direct feedback from the patients. Another example is when we're doing brain tumor surgeries where the tumor is located in critical areas of the brain. By performing the entire surgery when the patient is fully awake, we are able to directly stimulate areas of the brain to identify which area is critical. We get direct feedback from the patient. For example, if we are dealing with a tumor that sits in the area of sensation, and when we stimulate that area, the patient gets numbness. He goes numb. So because he's awake, he's able to tell us immediately, I feel numb in my hand, I feel numb in my face. Another case where a tumor is sitting in an area of the brain that controls speech. So by stimulating the area and the patient is awake, you suddenly see speech arrest. He's not able to talk. We get the patient to read from a newspaper, and as he's reading from a newspaper, we start stimulating certain areas of the brain which we think is critical. And if you stimulate that area and the patient gets speech arrest, then you know that's the area of the brain that you do not want to interfere with. You move away from the area. So in certain conditions, we do awake craniotomy to ensure that the patient's tumor is removed in the safest and effective manner. And patients typically tolerate the procedure well. They feel no pain because your nerve endings terminate at your skin. Your skull has very little nerve endings. Your brain, although it perceives pain, it has zero nerve endings. So you can literally operate on someone's brain while he's awake and the patient feels no pain.